foremost, I want to thank the county government of Kisii, represented here by the deputy governor, and also all our partners. Particularly today, we are also having a visiting professor from King's College London, Professor Lord Graham. As you know, the government is quite keen to tackle cancer as a scourge in the country. We currently have more than 29,000 people who die from cancer every year, 45,000 people who are diagnosed every year, more than 110,000 Kenyans, 110,000 Kenyans currently are undergoing cancer treatment. We have a big challenge when it comes to cancer response. We have 6 cancer centers in the entire country, as you know, that are government led. Recently, you saw 2 days ago, we were assisting county governments of Nakuru, Garissa, Mombasa to also manage their cancer centers, because we as a national government, under the leadership of His Excellency the President, are quite keen to ensure that the problems that are affecting Kenyans are sorted out when it comes to health. And cancer becomes a big problem for 2 reasons. One, it is that it is one of the reasons why many Kenyans die prematurely, but more painfully is the fact that even as we lose lives very prematurely, it is also quite costly in terms of the treatment, and so it also makes very many Kenyans poor. And so this institution is part of the response of the Kenyan government to ensure that we establish more cancer centers in the country. This is a national government project that we are doing. It has been conceptualized for a very long time. It had taken time off, and late last year we began this project. As you can see, it is progressing very well. We want the contractor to ensure that this project is completed by the end of this year, and that is the direction and the directive that His Excellency the President, Dr. William Ruto, has given us, to ensure that this project is completed so that it is responding to the needs of cancer in this region. As you know, we are having a huge cancer burden in this region: cervical cancer, breast cancer, colorectal cancer, esophageal cancer. And all of this, sometimes, of course, many people go to the neighboring Tenwek. Many people, as you know, go to MTRH. A lot of other people have to suffer in the buses in the night to go to Kenyatta National Hospital. And part of the decongestion is this. And from that perspective, we are also making sure that we pay for cancer care. As you know, we increased the package in the Social Health Authority so that we can make it easy for people to access care without financial burden. And we are keen to even make sure that that cost is reduced. You know that we have MOUs, that is memorandum of understanding, with even drug companies like Roche, where we have reduced the cost of breast cancer medicine from 120,000 to 38,000. This morning we were to meet with Pfizer again so that we reduce the cost of the medicines, because sometimes we say that we are paying 550,000 from Social Health Authority. Some people still say, oh, this is not enough. But we know from a government perspective that those medicines can be less costly. And that is also an intervention that we are making. We have more than 140 molecules across the board, prostate cancer, that we want to make sure that we reduce the cost by more than 60%. And we make sure that all these our cancer centers are working. And today, the reason why we are also visiting with King's College London is because once we build the center, once the government has set up the Social Health Authority to pay, once we have signed up with the drug companies to ensure that the cost is reduced, we must have the healthcare worker who is properly trained to do it. And that's the partnership that we have. So we are keen to ensure that this project is completed on time, it's completed on budget and to standard, and it becomes an example and a center of excellence for the entire Africa. Thank you so much. I would like to also appreciate my colleague PS, Dr. Steve Isaboke, who is the PS for Broadcasting and Telecoms, who in the spirit of whole government approach has also accompanied us to toward this project. And at this point, I would like to welcome him also to give his brief remarks. Thank you.
Members of the press and also members of Kisii County and the country. Like the PS colleague has said, my name is Stephen Isaboke. I'm responsible for broadcasting and telecoms, but I joined my colleague who is the PS for health as part of a whole of government approach. The project behind us is actually a key component of the PETA plan. And as you know, one of the commitments that was made by the fifth administration of His Excellency the President, Dr. William Ruto, was actually universal healthcare. And for this region, there was a commitment to actually establish uh, a cancer center of excellence, a cancer center for research that will then be used to actually help support our people. As you have heard from the medical practitioner himself, the PS for Health, cancer is now becoming a pandemic with the high numbers affected across the villages and across the country. And it's actually a big blessing for Kisii County and this region of Western Kenya that we actually have a big center here. So for me, is to witness the progress. And as you know, when the president was actually in Kisii a few weeks ago, after launching Yota, dispersing money and all that, one of the things he committed on the roadside after the groundbreaking ceremony was actually the cancer center. He did commit that he's actually identified a contractor, and I'm sure Panakiu, and I know him, uh, that a proper contractor has been identified. There was one who was doing a lot of Kitandawili before, that now this work has to be done and has to be finished. And that's why we are happy to see the contract on the ground because of the commitment to deliver healthcare to our people. So really to say, we will like to see this among his other projects delivered so that the services are delivered to our people amongst many other commitments that the president and the government has made so that we actually improve the quality of life of our people. I will speak more maybe in vernacular when the rest are done, but I actually want to say that, like my colleague said, we do get put into account and really put into strict delivery deadlines. And every time we're engaging the executive from the president or a head of public service, is around delivery of projects, delivery of programs, delivery of what has been committed. And in this particular one, I was witness as well, actually, when the prime minister was still alive, we again made a courtesy call on the president. And one of the things he raised as we were having breakfast before the address was Kisii Cancer Center. He knows the story, and he says, we will not allow any other Kitandawili again. This thing must be complete. And hence, the reason why we've come out with government to actually make sure we support the president to deliver this project. I thank you.
Thank you. We can have.
You move me to Kisii County. It's not my first time here. My name's Professor Graham Lord, and I'm representing King's College London, but also the Kenya UK Health Alliance, which was established by presidential mandate and has been supported by your current president. One of the very early missions that we had was how do we help to address the problems of cancer care in Kenya? How do you deliver cancer care and research close to local people where it's most needed? So this is about my third or fourth time in Kisii County, and it's really exciting to see this whole of government approach to deliver fundamental cancer care delivery for the people of Kisii so that they don't need to travel to other centres. And really, on behalf of the British government working in partnership with the Kenyan government, very much one of our first projects was based here in Kisii County. In fact, much of the origination of the idea of the partnership came from Kisii County. So Kisii is very much at the centre of our envisioning for cancer care across the whole of the country. And I'm just here to help support, provide advice. We run a lot of cancer centres in the UK. I've built cancer centres before in the United Kingdom as well. So I'm just here to support and to make sure that the care that's delivered here is as good as anywhere in the world. So you can, if you live in Kisii County, you can come and get your treatment here, and it's the best treatment available anywhere. And I think if we do that and deliver that, then I'll be a very happy person to have worked in partnership with you, the Kisii County government, the national government. And I applaud the words that both PSs have said about the government's commitment to seeing this project through to completion, and then critically making sure we have the highly skilled workforce to deliver the care and the research for all of the patients of Kisii County. So thank you very much for your very warm welcome as always. And I hope to be back very soon and seeing even further progress, and particularly when the hospital is opened and the first patients are treated. So please invite me to the opening and make the opening as soon as possible. Thank you.
Thank you. Thank you.
Much, PS, Luga, and your colleague Steve Isaboke. We want to thank you as a county government for coming today to come and witness what's happening here on the ground at this cancer center. And we believe your coming is a demonstration of the seriousness you have given this project. We know, as you have said, the cancer burden in terms of impact and cost is high. And the faster, therefore, this project is accomplished, the better. We believe once it's done, then the cost reduction in terms of disease will really come down and cost of treating the disease. We believe as a county government, we believe that you will get the job done and done in good time. We know that this is a serious project, the progress is good, but we want to request you, Dr. Oluga, that let it be done even faster so that this burden we are talking about of cancer will soon be a thing of the past in terms of cost and the impact. Generally, we would say we are happy and we believe the progress will be faster than it is now so that we realize the completion of this project. Otherwise, thank you for coming and we appreciate as a county government. On behalf of His Excellency the Governor, allow me to say a big thank you.
Thank you. So maybe I can just count na Nyamira mwenye kitingi mwensi na bakwendi mbiyamole. Ere tuwa chagaiga is a Kisii Cancer Center of Excellence. Kutara korora emegendere yegendere andi kaye kire gasi yegendere yoko chenga yoko agacha Cancer Center. Muna momanyete center ya chakita ngimya kibere ya edire ikaroswa lakini karate nake isabugulia ya mangana ndabete contract ni chikaschinde. Lakini ekere mwanene bwenso yo muya President William Ruto ire gasi okoba amangana ya afya alenge genteke mo kyaba begete sichipila chirisano chapeta tukuruka peta plan agatebe gente gekoru gekonya abantu bayito tari gusiyo lakini western omet paka Kisumu Vihiga the whole area ekorege chakoba a center egokonya abantu paka no abantu bande baro no Tanzania bachega no Uganda ekagera matuka mange kertomerene anda muna musani yone uteneta mangana yo afya ateba omonena kuja kubolinga cancer center ya gusinka ye kire andi mwa romo isonde no mwarenga mwa rochinga center ni TV ekereria kora nyota agakora akaenda kabike foundation stone matari nyambera keretwaje para igenta committed and you can check it on record nenga Kisii Cancer Center has to be complete. We care egera bantu bitu bakonya nke kora kore bintu byonsi egere abantu bayito banyore ogokonyeka banyore ebintu biri baganiti angena barabori ko kwenda Kenyatta usabandi bakanda no nyengumbu onyore ebintu biri byonsi bakuri no birange nsaye nke kora kore bintu omonene bwense uyo tenerete bono igare arigete mangana magendero kapisa development is his focus agokora nebi byakwana na byakora. And this project is a big project. No way you encourage billion is actually a testimony ngaya ebinto anyolete bindi byatigirete ncherana byagenda takora gere bikoru abantu bitu bakonye andi muno muroje amagendera yaho cha Kenya ngima tari asamura tabego se gare ga tariga kusiga mense eyamo ya Kenya androje bintakore nana kwana muna renge ya mangana ichpara mangana suneka airstrip amangana affordable housing muna baje kuruchicharaga iga at the city town center agera babe ka affordable housing chichiro cha Rosigo chi marketplace aggregation centers cha Rosigo binte bingi na mono muna deputy governor kwana umugabano ito musani one mwana minto His Excellency Governor Simbarati is not in the country, he's actually out of the country. Ago colleagues mono no manene byense babwata iniga eseki pale tamagendero sitoga bakonya bana baitu kabisa nechigasi nechipara nechskuru nebintu bina Cancer Center ebintu byonsi ipi egere ensi itegendera na mono muna mokora if you follow sometimes can go na at national level in seta kogendera if you cannot fix the fundamentals ebintu biri basic amangana afya mune to korera rogayo amangana ejisemi amangana ejipara amangana ibiasara gero bantu banyori chibe sankere gero to kora nyota na amangana digital ekorense yonsi bi akire digital no njeno tancha bono iga wika kero montaso ime na gikora na manene byense yerense mayane atama kera award enyore digital hub na kera chi school jinya gitari kere jinyore kwerende hotspots wifi hotspots egera asimuna mule asimuna ga yo kwa so esimi yao kwa so ime kwa check internet zo kora biashara byao zo kora bintu byao aina aramagenda finally ntebeiga inche no mwana ogusi inche na kina gusiga iga ngasoma gusiga iga ngamenya kwa national school nkaenda university kaba ngaiwe gas Kenya inche muna maite abagusimina tole ndina bantu bomokia abantu barigereti gas yabo nande bantu besigete bagwekorera na mono togusikana sana amasikania manene ekuru respect so egento ndacha abantu baito mubeka mangana siasa chinkoro chino imemo no muge siasa na tukoraga igentekere na magendero abantu mbangene especially abana yeah I'm finished igentekere na abana youth baito baerekeshwe sagia barigeria mangana isemi mangana ye obubundi mangana ichigasi amangana nyakibakora ubimo bwabo mbanga ino base kugera abantu baraga bana toro chinga kiende amangana yokurama is not our culture tukani abantu baende kere mokuru ina mora mane say no lakini moleta mangana isitoga we will love our peace egere tokorki tokonya abantu baitira magendero na bana baitu banyore opportunity bagende uchimutumu na tuabere biemono sana sabe nine biemono. Yes.
Before you address, you can also. Thank you. So, first on our issue about patients, recently we commemorated the World Cancer Day, and we spoke to this at length. There are a number of Kenyans who, as we've mentioned, are suffering from cancer, and we want to do two things. Number one is to improve their experiences while they are seeking treatment. And number two, we want them to live longer. That means we improve the outcomes. Now, that is why we are investing in these cancer centers, including Kisii. Now, a number of those Kenyans, some of them go abroad. And the Kenyans who are going abroad, we are also cleaning up that space. As you know, the Cabinet Secretary for Health, Honorable Duale, gazetted the conditions and the procedures that cannot be done here in Kenya. Now, many people, and here we have to be extremely firm, there are many agents who come to the villages, and because cancer is a very painful thing, they cause misinformation. They take some of these patients, they go with them to India and many places. They have not followed the procedure. Once you have not followed the procedure, it is almost impossible for the Social Health Authority to pay for you. We have worked with our Ministry of Foreign Affairs, and between myself and PS Ngoe, we have established a procedure through our embassies, Kenyan embassies abroad, so that we can track every single Kenyan who is seeking care abroad. The Social Health Authority has within it a mechanism, and I'll just talk about three of them. Number one is that when you seek care here, at least two doctors must give you a report. That report must be authenticated by the Director General for Health, Dr. Amoth, and then it is forwarded to the Social Health Authority. This does not take time because everything right now is digitized, okay? So it can be done. Many people do not follow that procedure. The second bit is that you must be going to the hospitals that our embassies have already worked with the Foreign Affairs and the Social Health Authority, and we have identified that these are the hospitals that we can verify that they will give you the proper treatment, and that list of hospitals exists. And number three is that those hospitals should have agreed that they can be paid by the Social Health Authority, because these are the challenges that we are facing. I know that many Kenyans sometimes seek the problems, and related to that is the investments that we are making in the Social Health Authority, so that many of these problems are treated here locally. And that is why we are even having these partnerships. We have the Kenya UK Health Alliance, which my colleague has asked about, and that's why Professor Lord Graham is here. Part of it is what we call workforce development. Workforce development is training through King's College London, University of Manchester, Christie University, Leeds, and all of this, including the Kenyatta University Teaching and Referral Hospitals, Kisii University, Jaramogi, everywhere. We are trying to ensure that we build skills and we build specialists that can do some of those things that make people go abroad. And that is the partnership that we have. And we have done a lot of exchanges, a lot of scholarships, a lot of fellowships, including for some of the skills that we don't have here locally. And we continue to sponsor. I think even my good friend Fred Omari is here. We continue. The Kenyan government is sponsoring. This year alone, we have put more than 400 million just to train doctors and healthcare workers on key issues that make Kenyans go and seek care abroad. And so far, we have already paid up to 98 million to universities that are going to train Kenyans to get those skills. Thank you.
Okay, thank you very much.
So this the one, this the chemotherapy. This is the chemotherapy. Where is it?
There. Where that existing hospital.
Oh, okay.
So we're demolishing that.
It's the main thing for
The boiler. The one that is
But it's ready, it's ready.
the 1+2.
Plus it's 2 years.
Yes.
Not a PhD.
It's beyond PhD. Because you guys for me very big volumes of documents.
Yeah. The quality of the
And I go to Cancer Centre in Manchester.
Yes.
The Patterson Cancer
So he
Centre.
writes very big volumes of documents. And when I look at those things, I only ask him one question. Are we finishing the center or not?
Yeah, you are. Now we are finishing.
Yes, this is our PhD study.
To walk quickly.
Twendeni kabisa ndio tupate hizi mambo.
So when are you doing this? You are confident that you are 1+2.
Yes. Oh yeah. The other one is 4.
The other is 1+4.
Yes.
This is a construction site, so don't worry. Carefully and take care of yourself. Now, team, please, let us be orderly here.
So there we have the water tanks. Yeah. The water tanks are there. That's the building.
The boiler.
Hello.
Yeah.
Where is the resident? Come out.
That's it. No public around. Down on the phone.
So wanaenda hivi, wanaenda tu alafu wakuja wafanye press briefing hapa. So, excuse, wanafanya kazi.
No, this thing must be completed.
Okay, you have to because of excess of time. Let's move. Let's move. Engineer. Yeah.
Amarat.
This place has no.
Yes, how far is it from completion?
Others, please remain behind the applicants must be brought. Begin about the woman, please.
Gracias.